Hello everyone, this is Dr. Deepika Tikku from Simply Pharmacology, and I'll be taking up now two videos regarding the important topics to be revised for university examinations, because as the exams are approaching for many students, so I would just like to, when they are about to revise for the exams, so कौन से important questions हैं which you should not miss out on. So I'll be covering this in two lectures, and the first video is this one. So let's go to the first one, which is your general pharmacology. ठीक है, जनरल फार्माकोलॉजी में टाइप्स ऑफ ड्रग्स, एसेंशियल ड्रग्स की डेफिनेशन, ऑर्फन ड्रग्स क्या होते हैं, प्रो ड्रग्स क्या होते हैं, यू आर सपोज टू नो दैट. Then in the routes of administration, though all routes are important, but somehow many questions are usually asked for sublingual and transdermal more often. So sublingual route you should lay more stress on, and transdermal. So transdermal में जब भी question आएगा, just make a nice diagram, label it properly, and then give the examples and what are the advantages of. So whenever ऐसे question आते हैं routes के बारे में, so just give an introduction about what the route is all about, and then you are going to actually talk about their merits, मतलब what is the plus points and what is the negative or the minus points. Then do's and don'ts of writing a prescription. Do's and don'ts of writing a prescription में आपको पता होना चाहिए. Prescription आजकल it is very important because every medical professional, every doctor supposed to know what or how to write a prescription, right? So what are the parts of prescription and क्या-क्या चीज़ें are not allowed in a prescription. For example, short forms are not allowed. Writing should be nice, and decimal points का ध्यान रखना है. अगर 0.5 है तो 0.5 लिखना है, और पेशेंट के सारे पूरे जितने भी उसके demographic characteristics हैं, you have to write about that. The doctor के क्या क्या होना चाहिए, the signature, the registration number, everything. So that is what you should be able to write. So whether you are given how to write a prescription or you are given a question जहाँ पे prescription दिया हुआ है and you have to find out the errors in the prescription, that is also important. Then special drug delivery systems, which are the newer drug delivery systems. So इसमें हम nanosomes, liposomes के बारे में लिख सकते हैं, right? Then even ocucerts, those kinds of things can also be written about in this, nanoparticles and all those things. So newer special drug delivery systems are asked in the university examinations. Then coming to pharmacokinetics, it is about factors affecting absorption or bioavailability. So all the factors you're supposed to list, and most important factor आएगा आपका first pass metabolism when it comes to the factors. So first pass metabolism can be asked as separately the short note, और अगर आपको factors आता है, factors affecting the absorption of a drug, then you have to mention, of course, about first pass metabolism along with the other factors. Volume of distribution as such, उसमें जो question आ सकता है, it is about the importance of volume of distribution. What happens अगर जिन drugs की volume of distribution low होती है, उसका क्या significance है, जिसकी high है उसका क्या significance है. So that is what you're supposed to know about the volume of distribution. Then very important is the clinical significance of plasma protein binding, because plasma protein binding comes under distribution. So what is the significance of plasma protein binding? इसका मतलब indirectly volume of distribution से ही है. So अगर plasma protein binding is more, then obviously the volume of distribution would be less. वो एक significance आ जाती है. Then you write about dialyzability of a drug. अगर drug plasma protein bound ज़्यादा है, क्या हम उसको डायलिसिस से रिमूव कर सकते हैं. डिस्प्लेसमेंट रिएक्शंस आ सकता है. देन डिजीजेस विच आर अफेक्टिंग द वेरियस लेवल्स ऑफ प्लाज्मा प्रोटीन्स, उनके बारे में आपको लिखना है. दैट इज अबाउट द क्लिनिकल सिग्निफिकेंस ऑफ प्लाज्मा प्रोटीन बाइंडिंग. Then next is in the metabolism induction. Enzyme induction is more important than enzyme inhibition. So you should know what is like biotransformation क्या होती है, examples, induction के examples. अगर biotransformation पे question आते हैं, then you would mention that there are two phases of reaction, phase 1, phase 2. What are the different reactions occurring in phase 1, different reactions occurring in phase 2. And then you can say that about the cytochrome group of enzymes, they undergo either induction or inhibition. Non-cytochrome does not undergo that. So enzyme induction with examples and the consequences. So what are the examples of enzyme inducers? All the important drugs you list out, and then what happens if a drug induces the enzyme of the which is important for the metabolism of the other drug. तो क्या consequences हैं, क्या uses हैं, ये सारा हमने enzyme induction में mention करना है. Enzyme inhibitors with examples. So enzyme inhibitors also you have to tell what is the various drugs, examples of enzyme inhibitors, and can they be used somewhere, so if you go through my my video lectures, I've already mentioned about in my course lectures, I talk about all these in details. Then it is first order zero order kinetics, very very important. Again, what is the difference between the first order kinetics and the zero order kinetics? So zero order kinetics examples are very important because they are not very good kinetics. And what is mixed action kinetics? And then what is the significance of half-life and steady state principle? Plateau principle, steady state principles का मतलब क्या होता है, and how many half-lives are required to reach it? Then loading dose and maintenance dose. Actually, they are more important calculations. अगर आपको exam में कोई numericals आते हैं, something like that, and that you are supposed to actually. Then we talk about the therapeutic drug monitoring. So which are the situations जहाँ पे therapeutic drug monitoring useful है, and which are the situations जहाँ पे therapeutic drug monitoring useful नहीं है, आपको उसके बारे में लिखना है. Then types of ADRs, A, B, C, D, E type. You mention all the types of ADRs, and again you give the examples with each of them. Teratogenicity is very important. Short note as asked sometimes on teratogenicity. And उसमें क्या होता है, then you write about the various phases कि कौन से trimester में ज़्यादा problem है teratogenicity की. What are the drugs जो pregnancy में category of different drugs होती हैं, which is supposed to be most teratogenic, which is not supposed to be, और evidence नहीं है उनका ज़्यादा teratogenicity का. So you write that. Pharmacovigilance short note, बहुत लंबा details करने की ज़रूरत नहीं है, but you should know what is the meaning of pharmacovigilance, what are the centers which are responsible, and इसका process कैसे होता है pharmacovigilance का, how the flow chart कैसे है, like from where do we collect and ultimately कहाँ जाता है, and that is what you're supposed to know in the pharmacovigilance. Then clinical pharmacology में और क्या important है, basically pharmacogenetics. Pharmacogenetics is very important because वहाँ पे जितने भी I think around 13-14 reactions ऐसे होंगे which they are dependent upon individual genetic variations in the individual. कईयों में जो enzymes हैं they are faster, कईयों में they are slower, and examples you should know about pharmacogenetics. Factors influencing the choice of drugs, basically they mean which factors will modify. For example, age है, weight है, surface area है, disease conditions हैं. So all these things are genetic variations हैं, environmental health factors हैं. So all those conditions which will actually influence like which drugs are you going to prescribe and how you're going to prescribe, कैसे influence होता है, that is the meaning of factors influencing the choice of drugs. Clinical trials, all the phases of clinical trials, ठीक है, till phase 4, and you should know a bit about what is important is कि phase में एक तो population कितना है जो involve होता है, किन में करते हैं, healthy volunteers में करते हैं या patients में करते हैं, and approximately small number है कि large number है, hospital setting में करते हैं कि general public में करते हैं, general population में करते हैं. So these are the important. क्या देखते हैं, efficacy देखते हैं, safety देखते हैं, what are we looking for, ठीक है. So these are the 4-5 things that you should know about the trials. Then drug schedules, mostly this is a question usually for post graduation. They might not ask so much in undergraduation, but sometimes MCQs में पूछ सकते हैं, especially schedule Y is very important, ठीक है. So according to the trials various जो होते हैं, so this schedule is more important for that. So this was about the general pharmacology. About the autonomic nervous system, इसमें transmissions, cholinergic है, adrenergic transmission है, that you're supposed to know, and especially कौन से rate limiting steps है you should know, and drugs acting on these various steps, कि कौन steps को किस point पे inhibit करता है, वो वाला पूरा डायग्राम आपको ट्रांसमिशन के साथ आना चाहिए. Adrenaline, noradrenaline, dopamine. There are three more important drugs. Adrenaline के बारे में सब कुछ पता होना चाहिए. Adrenaline के बारे में इसके uses, what receptors it acts on, जैसे हमने क्या vasomotor reversal of Dale, क्या क्या होता है, how does it affect, so everything about adrenaline, especially uses, life-saving uses of adrenaline, very very important. And कौन सी dose में use करते हैं anaphylactic shock, and किस route से देते हैं anaphylactic shock, very important. How is it different from noradrenaline? What are the differences in this? ठीक है. Then dopamine, because dopamine, what are the receptors on which dopamine acts, and उसके dose के accordingly इसके effects होते हैं. Small dose पे, intermediate dose पे, and high dose पे. What are the various effects shown with dopamine? कहाँ इसको use करते हैं? How is it different from dobutamine? So these are the things that you should know. Sometimes questions have been even asked on nasal decongestant, so you can know, especially you can even read about them, nasal decongestants. Then practical image-based questions on dogs' blood pressure. You can refer to my video. I have already done a video on the various image-based questions on dog BP. So you can refer to that video. I've explained in detail what the questions are and how you can answer them. Beta 2 agonists, more specifically, especially because they're used in bronchial asthma, so they are quite good, important. Indirectly acting sympathomimetics. So short note on indirectly acting sympathomimetics. That is what is important here. Then classification, uses of alpha blockers and beta blockers. Beta blockers are by far one of the most important topic in ANS. Very important. You cannot go to an exam not knowing them. Classification है, uses है, adverse effects हैं, आपको सब आना चाहिए. Alpha blockers also uses are very very important. Then cardioselective आपको आ ही जाएगा जब आप classification करोगे, so it comes with this. Then treatment of pheochromocytoma, basically question ज़्यादातर पूछते हैं. एक तो आपको drugs पता होना चाहिए, alpha blockers हैं, beta blockers हैं, and why, which one is given before. ठीक है? Can you give beta blocker before alpha blocker? So if whatever, you have to comment on that, right? Drugs used in bladder dysfunction. So I have seen this question somewhere. What are the various drugs used in bladder dysfunction? So you have to know about those drugs. Then again, drugs effect on rabbit eye, rabbit ileum. So eye में जैसे हम drugs करते हैं, क्या क्या effects होते हैं? Mydriasis है, meiosis है, effect on the corneal reflex है. So sometimes this question can be asked, though I will not lay much stress on rabbit eye, but yes, for MCQ basically, theory may I doubt, but for MCQ they might ask you rabbit ileum and rabbit eye. Mushroom poisoning, again very important. Various 3 types of poisoning, and what are the treatment differences in all the 3 types. Anticholinesterase is very very important. So how do you classify anticholinesterase and what are the uses of anticholinesterase? So OP poisoning, again, management of OP poisoning. What is OP poisoning and what is the drug of choice in OP poisoning, and what is aging of the enzyme. Myasthenia gravis, again very very important. Short note on myasthenia gravis. Why neostigmine is preferred over physostigmine in myasthenia gravis. Glaucoma, another important question. Management of narrow angle, wide angle, दोनों का what is the drug of choice? Difference क्या है दोनों में? You have to know them. Then classification of anticholinergics. So इसमें basically if you see, when you classify anticholinergics, you also classify them according to their uses. तो अगर आपको classification आती है, आपको इनके uses आते हैं, so आपका एक ही बार में काम solve हो जाता है. So again, a difference between active and passive mydriasis, and one of the very important questions is uses of atropine and its analogs. So analogs के सारे जितने भी हैं, if you remember the classification, ये वाला जो uses है analogs का, you अपने आप you can answer. ठीक है? So where are the various, like which drugs are used for management of inhibition of gastric secretion, which drugs are used to in drug-induced Parkinsonism, which drugs are used in asthma, which drugs are used in bladder dysfunction. So classification भी ऐसे ही हुई है. So if you know the classification, this question is automatically done. Then we come to the other topic, which is autocoids. Autocoids में antihistamines are more. Histamines is not much as important as antihistamines. उसमें भी difference क्या है? Why second generation they are preferred over first generation as antihistaminics? Treatment of acute and chronic gout, दोनों acute and chronic gout दोनों होना चाहिए. Difference क्या है management में? Drugs कौन सी use करते हैं अलग अलग? Why allopurinol is not used in chronic gout? What is the reason? Treatment of rheumatoid arthritis. So all the drugs, whether they are the disease modifying drugs or the other drugs, so you have to know about the management. So all the drugs for RA. Migraine का management. So drugs for acute as well as prophylaxis में कौन सी drug use करते हैं आपको पता होना चाहिए. Acute migraine में and इसमें triptans another short note है इसके अंदर जो आ जाता है. Mechanism of action, uses of aspirin. Aspirin and paracetamol are two important drugs. Aspirin के बारे में सब कुछ पता हो, uses भी हो, adverse effects पता होना चाहिए. Paracetamol poisoning पता होना चाहिए. What is the treatment or antidote for that? That you should be knowing. And what are the benefits of like COX-2 over COX-1 inhibitors? Differences in actions में basically. Then various drugs acting on the serotonin 5-HT receptors, because 5-HT3 वाले important है, 5-HT4 वाले important है, 5-HT1 वाले important है ज़्यादातर. तो ये सारी drugs आपको बतानी चाहिए. Respiratory में mostly it is management, और अगर long question है drugs for bronchial asthma. अगर short note आता है beta-2 agonist, we already discussed. Mast cell stabilizers पे I have seen question. And the management of status asthmaticus. ठीक है, that is very very important. And another question, why ipratropium is preferred over atropine in bronchial asthma? So when you do the atropine, वहाँ पे आप करोगे analogs में, वहाँ पे भी question का आंसर मिल जाता है. Why ipratropium is preferred over atropine? Then coming to CVS. CVS में Firstly, अच्छा अगर हम arrhythmias की बात करेंगे, arrhythmias for undergraduates, what I will lay more stress on is the classification and हर एक class का mechanism of action. So whether it is the sodium channel blockers or potassium channel or any other mechanism, all those classes आपको पता होने चाहिए. That is very important. Treatment of PSVT, और उसी में एडिनोसिन आता था, एडिनोसिन पे शॉर्ट नोट भी आएगा. सो ट्रीटमेंट ऑफ PSVT इज वेरी इंपॉर्टेंट. क्लास 3 ड्रग्स, मोर स्पेसिफिकली आस्क्ड क्लास इज क्लास 3 ड्रग्स. ठीक है. देन डिजॉक्सिन. डिजॉक्सिन इज समथिंग यू कैन नेवर. CVS में दिस ड्रग, even though it is not used much, but somehow this is favorite of all the examiners. Whether it is the mechanism of action of digoxin, source of digoxin, uses of digoxin, adverse effects of digoxin, everything about digoxin is important. So do not miss this question. ACE inhibitors, another very important. What are the classes, names of the drugs in ACE inhibitors, and where are they used, and the side effects? तीनों चीजें important है. Role of beta blockers in heart. Beta blocker, as such I said, it is very important. So whether they are used in angina, whether they are used in heart failure or as antihypertensive, everything is important about beta blockers. So role of beta blockers, because it's controversial in heart failure. Then newer drugs which are given for CHF. And why in antihypertensives may why thiazides are preferred as antihypertensives as compared to loop diuretics? This is a reasoning question asked. And the drugs used for hypertensive emergency and emergencies. So which drugs are used by parenteral route? Which drug are used by oral route? Whether it is an emergency or an urgency, that, and what is the difference between hypertensive emergency and urgency? That is very important. And then we have drugs acting on the renin, angiotensin, aldosterone system. जितने भी drugs हैं, आपको वो पूरा जो system है, you should know what is that and various drugs affecting that system. Very important. Drugs for angina, especially more stress you should lay on the nitrates. Very important is the nitrate, mechanism of action of the nitrates. Monday's disease, what is nitrate? Tolerance होती है nitrates से. What everything about nitrates you should know. Calcium channel blockers. Again, the blockers की classification है. Which calcium channel blockers are specific for heart? Which calcium channel blockers are specific for blood vessels? तो उनके uses भी accordingly different होंगे. So this is another important. Which calcium blocker, channel blocker can be given with beta blocker? Which calcium channel blocker is absolutely contraindicated with beta blockers. So again, I already have a video on these topics, calcineurin blockers, and on the drug interactions of beta blockers. You can go and check out and see for yourself. Then coronary steal phenomena. Which drugs show what is coronary steal phenomena and what is actually, what happens in coronary steal phenomena. That is very, very important for you to know. So this was the first part of the important questions which I've covered. And in the next video, I'll be talking about the other important questions. So I also, if any of you who are exam going and they're interested, or someone who's just joined pharmacology, if you're interested in, joining a very comprehensive course in pharmacology, I have videos I have recorded on all these topics. And there are various modules that I provide, and the questions, all these questions are discussed there. So you can, join me at drdeepikatikku.com, and you will find it very helpful because it is tailor-made for the MBBS or the dental or the nursing student. Anybody who's dealing with second year pharmacology, that is a tailor-made course for that. So thank you so much. So see you in the next video. Take care. God bless.